November 15th. Check. Sound check presenter's laptop. Sound check presenter's laptop. Clerk's laptop. Sound check. Sound check clerk's laptop. Okay, so we're live and we will wait for quorum.
We'd feel better with donuts and a coffee.
We always do. Yes, thank you, Counselor.
Just in terms of if we are live, good morning,
Yes, we are.
everyone. It is the November 15th Board of Health meeting. Just waiting to fill quorum before we can commence. Clerk Kohler, are you there?
Yes, Madam Chair.
Oh, thank you. Are we able to proceed on those matters that do not require or are not asking for any direction? I'm thinking specifically of the COVID update.
We would need a motion to receive the
Right. Okay. Thank you. Yep.
presentation. That is the sticker,
Okay.
the sticking point.
You're right. Yeah. Thank you. I don't
Yeah,
know why.
understood,
I didn't think
though.
of that. Yeah.
Generally, yes. I mean, the committee can decide if they are just want to discuss things, and of course, they can't approve or receive anything.
Mhm.
So we're there, but we
Okay.
continue to wait.
Okay.
I'll
Thank
send
you.
another message out to councillors. Ah,
Seat.
morning, Councillor Marula.
Good morning, Madam. Is that Madam Chair or is that Madam Clerk?
It's Madam Clerk. It's Lorraine.
Oh, good morning, Lorraine.
Councillor Johnson has declined, so she is not coming. Jackson has not responded.
If any members of the public have just joined us, this is the City of Hamilton Board of Health meeting. We're just waiting for quorum to be uh, fulfilled. Thank you. Again, if any members of the viewing public are watching, our audio is working just fine. It is a public health, a Board of Health meeting at the City of Hamilton. We're just waiting for quorum. Thank you.
Good morning, Councillor Jackson. It's Lorraine Kohler from the clerk's office. How are you today, sir?
Good. How are you, Elsie Kolar? Good morning.
Fine, thank you. Madam Chair, we do now 1, 2, 3. Councillor Ferguson. Councillor Ferguson, are you with us at the meeting? I can see you're on WebEx, but I can't see or hear you.
Councillors are present at the meeting. Could you turn your video on, please?
Council colleagues, good morning. My apologies. I didn't realize you were waiting for quorum.
Good morning, Councillor Jackson. If members are present in the meeting, if they could turn their video on so we can know that quorum is established. Thank you. Lorraine?
Quorum is now present, Madam Chair.
Thank you so much. Good morning. We are halfway through November, believe it or not, the date being November 15th. We are at the City of Hamilton Board of Health meeting, and I would like to call this meeting to order. Members of the public are advised that our meetings are webcast live by the City of Hamilton and temporarily archived on the city's website. All electronic devices are to be switched to a non-audible function during council meetings. Members are reminded of the 5-minute time limit, which will be adhered to during this meeting. Members can submit another request to speak if they require more time to ask questions or make comments. I will be the official timekeeper, and I will be including only the time in which you are at the mic, as opposed to including the answers that will be provided to you. Quorum is present. Clerk Kohler.
Yes, Madam Chair, quorum is present.
Thank you. Are there any changes to this morning's agenda?
Yes, we have some additions to change to this morning's agenda. Under communications item 5.4, correspondence from Walter Furlan and Liz Duval respecting the proposed safe consumption site located at 746 Barton Street East in Hamilton, with a recommendation to be received. Item 5.5, correspondence from Jacinta Ribeiro, Luso Support Center of Hamilton respecting safe consumption site, with a recommendation to be received. And item 5.6, correspondence from PJ Daly, Hamilton Wentworth Catholic District School Board respecting a safe consumption site, also with a recommendation to be received.
Thank you, Clerk. May I have a motion to approve the agenda as amended? It is moved by Councillor Pearson and seconded by Councillor Ferguson. Are there any discussions on the agenda as amended? Seeing none, please indicate your yea or nay.
The vote is now open. Councillor Jackson, I see your thumb. The vote is closed. Closing. Sorry, just a slight technical glitch. Don't make me cancel. My apologies. Something has gone wrong with that vote. I'm opening the vote again. To me, please vote again.
Thank you, Clerk.
Don't quite understand what happened there.
I think Councillor Jackson's thumb is not
I-
broken.
yes,
It looks
I
pretty
see.
straight.
That's about the only thing that is working for me this morning. Thank you very much, Councillor Jackson. Councillor Danko, are you able to vote? Again, pardon. Thank you very much. Okay, we'll try it again. And that vote carries 9-0. Thank you.
Thank you. Members of Council, are there any declarations of interest? Seeing none. We'll move on to the approval of the minutes. May I have a motion to approve the minutes as presented from the October 18th, 2021 meeting? It is moved by Councillor Vanderbeek and it is seconded by Councillor Marula. Please indicate your vote.
Go. Vote closes, and that carries 9-0.
Clerk, we have correspondence items 5.1 to 5.4 on the agenda. Are there any questions on any of these items?
If I may interrupt, it's
Oh.
my apologies. That's my typo on the chair's procedures. It's 5.6.
Thank you very
5.1
much.
to 5.6. Yes.
May I have a motion to approve the items 5.1 to 5.6 as presented? Oh, I see a speaker. Councillor Farr, would you like to speak to one of these items?
Thank you, Madam Chair. And just to, through you to Michelle, we're just receiving 5.4, 5.5, 5.6 correspondence from our chair of the Hamilton Wentworth Catholic District School Board as part of 5.6, or is 5.6. All three are on the safe consumption site. The AIDS network, as we know, stepped up. Ward councillor's not here, but simply receiving it, I'm wondering if, in fact, I'm assuming, and I'm probably right, that Michelle, you're already on these three correspondence items, and you're speaking to these individuals.
Director?
Correct, through you, Madam Chair. So all of these correspondence we are aware of. We have been following up directly with Councillor Nan, as well as the AIDS Network on these individual pieces of correspondence and the issues here. The AIDS Network is continuing with community consultation, and they are the applicant for the CTS site within Ward 3. So yes, we are addressing these as they come in.
And prior to the opening of the site, as I recollect through you, Madam Chair, of any safe consumption site, that was a requirement, if I'm not mistaken, of my original motion some years ago, correct? Like get out there, engage early, engage often, right? Through you.
Yes, through you, Madam Chair. So there is a requirement within the consumption and treatment site application, that is the provincial application, that the applicant go through a community consultation. And so they are certainly aware, and the ward councillor as well has been engaging with them with respect to what that consultation looks like. And so anyone that has feedback with respect to the site or has questions or concerns is encouraged to go directly to the AIDS Network. They do have a survey up on their website, and
Okay.
they are engaging with people now on feedback.
Okay, and as the board would know, I, having had the inaugural location, thanks to unanimous support from council, we put those engagement pieces in for a reason. It's something new still, notwithstanding there's been one with urban core in the core of our city for some years. There is an understandable reaction that you get from some in the community, and particularly as is the case here with the school. I think it was 200 meters away, and other residents and a business fella who lives next door, I believe. I read it on the weekend. My apologies for not rereading in advance, but there is questions, understandable. All things said, I think I'm of the mindset of the councillor of Ward 3. Really what we need to do is expand these services and make them less of a spotlight issue. I think Councillor Nan has mentioned in the past they should be at safe consumption sites, should be at all of our drugstores. I believe, and Michelle and I have talked about this, that we may already be having the conversation that our shelters start contemplating safe consumption and therefore reduce the stigma and alleviate some of those concerns when you're working in isolation with a limited number of consumption sites. So through you, final question to Michelle, Madam Chair. Are those conversations happening?
Through you, Madam Chair, yes. So there.
Director, I'm sorry to interrupt. Would you be able to identify yourself and your position? Thank you.
Absolutely. So it's Michelle Baird. I'm the Director of Epidemiology, Wellness, and Communicable Disease Control. So through you, Madam Chair, yes, conversations are happening with different providers, and certainly there's been work happening previously with shelters, and you're absolutely right that we do need additional consumption and treatment services within the city. The opioid crisis in Hamilton continues. We're seeing an increased number of deaths and paramedic calls for opioid overdoses overall, so certainly those conversations are happening.
All right, thank you. And so simply receiving is fine because it sounds like it's in good hands, as always with Michelle. Thanks, Madam Chair.
Thank you very much. And just for the viewing public, I know that because she was referenced, Councillor Nan is on City Business this morning and did send her regrets to us all last week. I have Councillor Clark, please.
Thank you, Chair Wilson. May I ask Director Baird a question? So what is the city's role in the approval of this site?
Thank you. Through you, Madam Chair. So the consumption and treatment site, really there are two approval pieces, and I'll explain where the city comes into play. So there is a federal approval for a supervised consumption site, as well as a provincial approval for a consumption and treatment site, and that ultimately approves the funding portion, both operationally and capital for the site. To go a piece within the provincial consumption and treatment site is a local municipal endorsement. So that would have been the endorsement that was gained through the October Board of Health and ultimately Council.
Thank you. And Chair Wilson, specifically to item 5.6, Chair Daly's letter, it sounds as though no one has spoken with the school board. So how do we make sure that such consultation with this particular board regarding this particular school, because it's in such close proximity? Chair Wilson?
Director, please.
Yes, through you, Madam Chair. So with respect to the schools in fact are one of the sites that is required to have consultation through that consultation process. And if there are schools within a 200-meter distance, part of the application process requires not only consultation, but that there's some plans in place to mitigate any concerns that might be there. So that is a requirement of the consultation. And so in our discussions with the AIDS Network, they're well aware that they need to have consultation and probably some mitigation plans with the local school board.
So you're confident that they're going to reach out to Chair Daly and the board to hear out their concerns and see what mitigations can be sought after?
Yes, through Madam Chair, that is required for their application.
Thank you, Director. Thank you, Chair Wilson.
Thank you. I don't have anyone else on the speakers list. I need a motion to approve items 5.1 to 5.6, moved by Councillor Pearson and seconded by Councillor Farr. Please indicate your vote.
Vote is closed, and that carries 0.
Thank you very much. We're on to consent items, and Dr. Richardson is here to answer any questions you might have on the next item, which is 7.1, the Public Health Organizational Risk Management Plan 2021 Progress Report. May I have a mover and a seconder first to put the report on the floor, please? Moved by Councillor Pearson, seconded by Councillor Danko. Any questions of this item, members? Seeing none, please. Oh, I do beg your pardon, Councillor Clark.
Sorry, Chair. I was trying to get my computer to do what it's supposed to do, and it wasn't doing it. So I couldn't get my request in. I'm not sure why. It's just
No problem.
being angry.
It's
I'll stop-
November.
I'll stop beating up on my computer and beat up on myself instead. So through you, Chair Wilson, to the good doctor, when I'm looking at the risks that are in the red zone, are any of these a concern for you? I know we're not in that risk currently, but they're potential down the road.
Good morning, Dr. Richardson.
Good morning, Chair. Good morning, everybody. So thank you for the question, Councillor Clark. So as you know, the risk ratings for the risk management framework and plan are divided into these red, yellow, and green zones, with the red being the highest risk in terms of both the likelihood that they may occur and the impact that they would have if they did occur. And we have an unprecedented number of risks both on the plan overall and particularly in both the red and the yellow zone compared to where we've been before. And of course, that's driven by COVID and the current situation we're in. So when you ask me if I have any concerns regarding these, yes, I do have concerns regarding these. A number, essentially, most of them in the red zone, things like the uncertainty that we continue to have around the pandemic and public health modernization as it's continued to be discussed at the provincial level. And so that means, what ultimately will be the structure of public health as we go forward. Staffing is a particularly significant issue for us. Recruitment continues to be challenging in terms of the number of professionals that are available to work in our organization, nurses, public health inspectors, epidemiologists, all of the different types of staffing that we have. And we certainly see that there's great demand for the staff with these kinds of skills across the country. And so that's certainly a concern for us. Along with that, of course, goes the absenteeism and burnout. We certainly see that occurring in our workforce as others do across the health system. And so that is definitely a concern, as well as the lack of time to really get any recharge, which of course drives that ongoing risk of burnout as we go forward. We're disengaged. We have been disengaged in some ways from some of the significant planning efforts that are underway because of the attention of the organization to the COVID-19 response and to the highest risk public health programs that we have. And so we are trying to look at re-engaging with those key tables as we go forward and try and lift our heads to look beyond the next sort of 3 to 6 months. On the broader end, in terms of all of the programs and services that we do, we continue to have a number of programs and services that are not currently up and running, and we're going to speak to that a little bit more at the end of the COVID-19 presentation. And so we aren't meeting program targets that we would normally meet on a number of different levels. At the same time, we've had a lot of change as we go into the yellow zone, changing priorities, and so we continually spend a lot of time planning and replanning in line with what we have. It's work we need to do. It's essential that we do it, but the shifting in priorities does add a further level of challenge. And so, many of those that we're concerned about, I'm concerned about in particular.
Thank you, Chair Wilson. Can I ask the good doctor, on the personnel side, it's our resources. So are we currently short in your department staff? And if so, are we recruiting outside of the province, or do we only recruit within the province?
Through you, Madam Chair, we've essentially been on a continuous recruitment journey now for about 2 years almost in terms of trying to fill positions related to the COVID response, COVID vaccination, as well as key positions within the organization that are providing essential services. We are short, as I mentioned a couple of months ago, we're probably still short about 100 FTEs from what we would like to have in terms of the staff. We're definitely short in our skilled workforce, whether it's public health inspectors, public health nurses, epidemiologists as we go forward. Also in our supervisory and management ranks, senior management ranks, we don't, the structure we have ultimately isn't sustainable in that regard. And though we continue to recruit, it's a very challenging environment in which to recruit, both because of the pressures from other organizations, but just the fact that we've done as much recruitment as we have. We have a lot of onboarding to do, orientation, bringing people on board. It's a very time-consuming process, which again then takes resources away from doing the actual work. So it's a delicate balance that we continue to have in trying to continue to recruit without further impacting our ability to do the response. So at times we sort of step back and wait a bit to because we haven't had success for a period of time, and then we try again and try to recruit in some more. And we had, for example, 2 PHIs recruited in the last couple of weeks, which we're all ecstatic about. Certainly, the fact that a number of our positions are temporary has a significant impact. A lot of the other organizations that we speak with or see recruitment from are going ahead and hiring positions on a permanent basis. And so to be able to do that would have some impact for us. We anticipate in terms of being able to keep and retain the skills that we need here. And so we did contemplate bringing forward a report that would look at allowing us to go temporarily over complement with permanent positions, but hadn't at this point brought that forward.
Chair Wilson, did I hear correctly? The doctor indicated that we were short 100 FTEs in public health?
I heard that, but Dr. Richardson, please confirm.
Through you, Madam Chair. So just to clarify that a little further, so we had mapped out when we presented the annual service plan and budget to you in February or March of this past year, we had mapped out what we anticipated we would need in order to both restart our programs and continue the COVID-19 response, whether that's the case and contact management and outbreak management side or the vaccine response. And compared to what we would need in order to do that, yes, we're about 100. It depends where we're at in the cycles of opening and closing clinics and where we're at in terms of retention of staff, but we're about 100 FTEs short from where we would like to be. One of the things the public health leadership team is doing right now is looking at what we're calling the deficits of care. So typically in emergency response, you rank, again, using this red, yellow, green type of framework, you rank your programs and services based on what can be held for a short period of time, and then restarted, usually assuming that's going to restart within days to weeks. However, as you all know, we've been doing this now for 2 years. And so we have we have some programs for which, going back, we can't reinspect restaurants or tobacco vendors. It doesn't help to do that 2 or 3 times because they may have missed some in the preceding 2 years. But certainly in other areas, we definitely can. Whether that's in inspections when we go in and find that there are challenges that we hadn't been anticipating because of the fact we haven't been there to work with the vendors along the way, or because we have children who haven't been screened for their dental status or their immunization status, or a number of different areas where there might be increased demand over what we would usually see. So we're just looking at those right now, and you'll see that at the end of our COVID presentation. That's one of the key things we're working on. And would we be able to look at recruiting some personnel to help with some of those deficits of care?
And the last question, Chair Wilson, Dr. Richardson, have we considered or have we done recruitment ads in other provinces?
Through you, Madam Chair, our recruitment, Jen may be able to speak to this more fulsomely, but generally our recruitment is broad. Jen, are you able to add anything to that? It depends on the positions exactly where they get advertised. I'll just look to Jen Vickers-Manson to see if there's anything she wants to add.
Good morning, Jen. Are you with us?
I am. Good morning. Thank
Good
you,
morning.
Dr. Richardson, and through the chair to you, Councillor. Elizabeth is quite right. It depends on the positions, and we certainly are seeing applicants from a wide geographic band.
Jen, would you be able to introduce your position and your title, please?
My apologies, of course. Jen Vickers-Manson, Director of Healthy Families, Chief Nursing Officer for Public Health Services.
Thank you.
I guess, and I don't know, Chair, whether or not it's Dr. Richardson or whether it's our HR division. I'm just curious whether or not we have reached out beyond the province, because it would seem to me that almost all of the public health agencies in Ontario are experiencing the same issues. And if we're reaching out beyond the province, we may find some candidates who are interested to move here to the big city, as it were.
Thank you for the comment. And certainly worth consideration, seeing what more we can do, Councillor.
Thank you. And if we're short 100 FTEs, are we going to get a regular report on the fulfillment of those FTEs? And that's my last question.
Thank you. Dr. Richardson?
Through you, Madam Chair. So we do look at these issues. We tend to bring them back to you as part of the COVID-19 update on about an every 2-month cycle. As I said, we'd refer to them a couple of months ago in terms of where we were at, and then again today in terms of where we're at. I would be remiss of me not to mention as well that we have 75 FTEs from the province in addition to our own that continue to support us as well.
Thank you, Doctor.
Thank you, Councillor. Thank you, Doctor. Thank you, Jennifer. I don't have any other councillors in the queue for a question. Thank you. I believe I had Councillor Pearson and Councillor Danko moving and seconding that report. So if we could indicate the receipt of it.
Vote is now open.
Thank you.
Councillor Marula, are you able to vote? And that vote carries 9.
Thank you. Dr. Richardson, don't go away. You are here to speak to us on the next presentation, which is 8.1, an overview of COVID activity in the City of Hamilton. If you could begin, and appreciate everything that you do just as a precursor.
Thank you so much, Chair. I'll just share the PowerPoint. I'm just double checking Lorraine. Is that all working fine?
Looks great, Dr. Richardson. Thank you.
Great, thank you. All right, so good morning again, everybody. And we're going to go through and do for you our usual overall status update with respect to COVID-19, and our SITREP with Stephanie Hughes is here to speak to that more so. Our performance metrics we're going to look at as well, and then our COVID vaccine update, and then a few wrap-up comments as well. So just as we usually do, we give you a summary at the beginning just to let you know what's coming, and then you can look to the details as we go through. So the first is, of course, that our COVID-19 case activity, both cases and outbreaks, are tending to be stable just now. I know it says here that they're trending downwards. I see I've got the wrong PowerPoint. I'm just going to fix this, Madam Chair. Somehow I've opened the wrong one. Let's make sure we've got the right one. That's interesting. All right, this one says the right date. Let's try that again. Okay, now you see one that says November 15th, Lorraine.
Yes.
Madam
going
Clerk
to
has
double-
just stepped out for a moment, but yes, we're seeing the correct date.
Thank you very much. I'm going to just make sure that the next piece, there we go. Sorry about that. Yes, so there's that last line with the current public health services priorities as we go forward. So our case and outbreak activity in Hamilton has been maintaining at current levels for several weeks now. So we had been on a steady decline And then we had seen this leveling out on our cases as well as our outbreaks. And of course, we were seeing a similar thing across the province, and they were actually beginning to see an increase in case activity as well. And so we know that in consultation with the Chief Medical Officer of Health, Kieran Moore, that the province chose to pause its reopening process, which was due to start today, in terms of its next step, and wait for another 28 days to look at what was happening with case activity. As of November the 11th, we have 871,000 doses of COVID-19 vaccine that have been given, and 85.6% of Hamiltonians who are over the age of 12 vaccinated now with one dose, and 82.2% having chosen to receive both doses. We have updated our SCARS and forecast, and Ruth is here to speak to that. And it shows that Hamilton can anticipate an increase in cases with increased transmission risk due to an increase in indoor activities and reopening. However, severe outcomes, such as hospitalization and deaths, should be modest. They should not increase at the same rate as we've seen before. And overall, we are seeing that the control of COVID-19 remains dependent on both vaccinations and the practice of public health measures. And so as we continue to talk about going forward, one or the other is not sufficient in terms of maintaining control. And so it is very important that people continue to practice public health measures and go forward in ways that are compliant with the different situations and settings and the measures that are being recommended for those settings in order to maintain control over COVID-19. So at this point, I'm going to hand it over to Stephanie Hughes, who's one of our epidemiologists. But apropos of the conversation we were just having about staffing, Steph has been the voice of COVID-19 really from a SITREP perspective here at the Board of Health at our management tables, both within public health services and at the Hamilton COVID response table with all of our healthcare partners, hospitals, primary care, long-term care. She has been undertaking this work, of course, in cooperation with her colleagues, but of course had the public role of presenting this data now for over a year and a half. And Steph is an example of one of our very successful epidemiologists who has been recruited to work elsewhere. And so this is, in fact, Stephanie's last presentation she'll be doing here at the Board of Health, as she is leaving this week to go on to a job with our federal counterparts at the Public Health Agency of Canada. So Steph, it's over to you.
All right. Good morning, everyone. And really, thank you so much, Dr. Richardson, for the very kind words. And of course, thank you very, very much to the Board of Health for having me here every single month. It's been an absolute pleasure to present to you since, for about a year and a half now. I'm very, very grateful. So with that, I'm going to, of course, start with the same disclaimer that I start with every single meeting, that before I proceed with my usual case summary portion, of course, just to note that these data are accurate as of last Friday morning. So Hamilton does continue through wave 4 of COVID-19. Last time we met, I reported to you that wave 4 began mid-July of 2021. It hit a peak near the end of August with 80 cases reported to Hamilton Public Health per day and had been decreasing ever since. There were 25 cases reported to Hamilton Public Health per day on average at the time of last month's Board of Health meeting. Since then, our COVID-19 activity levels have been stable. Since about the third week of October 2021, Hamilton has been maintaining at consistent activity levels. So just to go back to Dr. Richardson's point on her outline slide there. So as of this past Friday, there were 15 cases of COVID-19 reported to Hamilton Public Health per day on average. And really, we've really been hovering anywhere between the 14 to 18 cases reported per day on average range for the past several weeks. Next slide, please. Thank you. So you will notice here that this slide does look very similar to last month's Board of Health meeting, and that is because I have only modified the information in the phase 3 or post-peak box. So Hamilton does remain in this post-peak phase of wave 4 of COVID-19. As I mentioned on my previous slide, we have been maintaining at the same levels of activity for several weeks now. In addition to our case counts remaining stable, both our numbers of hospitalizations and deaths have also remained low. Outbreaks declared throughout the post-peak phase have occurred in a variety of settings. So this is including workplaces, school and childcare, athletic settings, banquet halls, and also communal living settings. And recently, outbreaks have been occurring more frequently in school and childcare settings in particular. One of the changes I have made to the slide in the phase 3 box that I would like to highlight is the fact that there has been a recent increase in provincial COVID-19 activity. So throughout wave 4, the trend of COVID-19 activity in Hamilton has generally aligned with the province. So during the pre-peak phase, case counts in Ontario were also rising, similar to our trend. During the peak phase, case counts in Ontario were at their peak and high. At the same time, our case counts were at their peak. However, there are some differences between us and the province during the post-peak phase. Initially, both the province overall and Hamilton specifically were trending downwards. However, as I mentioned previously, our case counts have been stable for several weeks now, which is in contrast to Ontario overall, where COVID-19 case counts have recently increased. In fact, Hamilton is one of very few Ontario public health units to not be trending upwards at this time. The recent provincial increase in COVID-19 cases has prompted the pausing of provincial reopening and the Ontario Science Table to indicate last week that we're back in the 4th wave. Next slide, please. Thank you. So this slide here shows the incidence of COVID-19 throughout wave 4 in Hamilton, separated out by age group. So from the middle of July 2021 through this past Friday. And the intention of this slide is to show the age groups most affected throughout the wave. So looking at this graph, the younger to middle-aged groups, encompasses individuals aged 0 to 59 years, have been disproportionately affected for the entire wave thus far. And this can be seen by the blue and orange lines on this graph. You will also notice that there have been a few notable increases or bumps of the youngest age group, specifically, so those aged 0 to 19 years. There was a bump this past mid-September and also just recently at the beginning of November. I will dig into this a little bit more on the next slide to help explain what happened during this latest bump. So next slide, please. Thank you. So this slide here shows COVID-19 school cases reported throughout wave 4 here in Hamilton. When I presented these data to you at last month's Board of Health meeting, I indicated that Hamilton COVID-19 school cases primarily began in early September 2021 and peaked late September with an average of 11 school cases reported to Hamilton Public Health per day. Throughout October, Hamilton school activity decreased until the very end of October, very beginning of November period. Here we saw another rise in school cases. When we drilled down into our data, we determined that it was specifically individuals aged 5 to 11 that had increased. We are now seeing a decrease once again in Hamilton school activity. And as of this past Friday, there was an average of 2 to 3 school cases that were reported to Hamilton Public Health per day. And next slide, please. Thank you. So this graph here shows the number of active COVID-19 outbreaks throughout Wave 4 here in Hamilton. So from July 17th, 2021 through this past Friday. At last month's Board of Health meeting, I reported to you that Hamilton COVID-19 outbreak activity in Wave 4 began at relatively low levels. The number of outbreaks then hit a peak near the end of September with 25 active. Following the peak, the number of active COVID-19 outbreaks trended downwards and recently stabilized. So they have been stable since approximately the third week of October of 2021, which is similar to our overall case activity. And as of this past Friday, there were 8 active COVID-19 outbreaks in Hamilton. And with that, I'll pass it back to Dr. Richardson.
Thanks very much, Steph. And so at this point, we turn, as we usually do, over to the SCARSN forecast. And Ruth Sanderson, another one of our epidemiologists, is here to speak to that. Ruth.
Thank you, Dr. Richardson. My last forecast to the Board of Health on October 18th identified that we were cautiously optimistic that Hamilton's fourth wave had been contained. At that time, we were experiencing a steady decline down from the peak of our fourth wave at the end of August. Today, while we continue to be cautiously optimistic, the forecasts indicate that we must temper this optimism with the awareness that we must continue to actively navigate the delicate balance of reopening and control of COVID-19. I have to share with you today, for the first time, a look out to the end of January 2022. The forecasts continue to predict that the use of public health measures, along with our vaccination levels, will balance the increased transmission as Hamiltonians move indoors due to the colder weather and reopening. I'll show you that in the next few minutes that the updated reopening forecast indicates that while Hamilton can anticipate an increase in cases this year, much like many parts of Ontario have already started to experience, severe outcomes, such as hospitalizations, are likely to be modest due to, in part, to our higher levels of vaccination. This first slide provides an overview of what has been happening with community mobility, a proxy input we use in the model to monitor behavior and potential transmission. Since I was last at the Board of Health, Hamilton's community mobility levels have come down to -2% below pre-pandemic levels, as you can see on the far right. This is a good thing, as it generally indicates a reduction in potential transmission. Similar to community mobility, workplace mobility monitors changes in Hamiltonians physically going to the workplace. You can see on the far right that workplace mobility has leveled off at 16% below pre-pandemic levels. Again, this is good news. Fewer people physically going to work, if it isn't necessary, will generally reduce the opportunities for transmission. While 16% below pre-pandemic levels is positive for containment purposes, keep in mind that we have not seen levels this high in Hamilton since March of 2020. So I have 3 scenarios to share with you today. S1 is the maintaining public health measures, which you saw the last time I was here at the Board of Health. This scenario has been updated with the new case data, vaccination data, and mobility data. However, underlying assumptions remain the same, that keeping public health measures in place to the end of January 31st, 2022. The second scenario, S2, reduces public health measures. In particular, physical distancing and avoidance are set to decline gradually from November 15th down to 0% by February 15th, 2022 in most settings. And masking is lowered than it is in S1 and gradually declines to 0% by the end of March 2022. Scenario 2 is generally tracking the anticipated reductions in actual behavior and not necessarily the specific dates of the province's reopening plan. Scenario 3 is related to child vaccination, and it's brand new. I'm sharing this with you for the first time. It builds on the assumptions in the reopening scenario and adds in the impact of vaccinating children 5 to 11 starting December 6th and achieving 40% first dose vaccination by the end of this year. While we don't know yet the exact start date of child vaccination, for the purposes of this forecast, I assumed it would be December 6th. So here's the forecast for scenario 2, the reopening forecast. This graph goes all the way back to November 15th, 2020 on the far left a year ago to remind us where we were this time last year at the beginning of the second wave. I've also indicated in the yellow box where we were at the last time I brought forward a forecast to the Board of Health. Compared to this time last year, Hamilton is in a better position due to continued public health measures and vaccination. You can see on the right, a modest increase in cases is predicted in late November with reopening and added transmission risk from increased indoor activity. Cases may peak at 40 per day towards the end of December. However, to draw your attention to the delicate balance that we have struck, with a small increase in transmission, cases could get as high as 80 at the peak, as indicated by the red dotted upper boundary, or with reduced transmission, could hover around 20 cases per day, more or less where we are currently. Now, taking a look at the three scenarios and comparing them here on the slide for cases. Maintaining public health measures, reopening, and the new S3 reopening vaccination of children 5 to 11 are all in this graph. Notice I've zoomed the time period in on the left, on the graph on the left from July 17th on, which is essentially the fourth wave time period. I'd like to draw your attention first to the highest darker blue bar and the dashed line. This is the reopening scenario I just showed you on the last slide. Overall, we predict just over 2,600 cases between now and the end of the end of January 31st, 2022. What really stands out here is the gap between that orange bar and the dark blue bar. This is comparing the reopening scenario to the orange bar, which is keeping public health measures in place. If we, the S2 reopening scenario predicts 978 additional cases from today to the end of January 31st, 2022, compared to that S1 orange bar and the previous base of maintaining all public health measures in place. With S2, cases will primarily be amongst those 0 to 19, over a third in that, just at a third in that group, and 20 to 59-year-olds. If you look now at the lightest blue bar on the far right, the S3 scenario, which is the vaccination of children aged 5 to 11 starting in December, you can see that we can prevent approximately 113 cases in the new year compared with the reopening scenario. Now, keep in mind the benefit of child vaccination overall in terms of reduced cases will be greater in 2022 as we reach higher levels of child vaccination and second dose administration that would be off of this graph currently. Moving towards hospitalizations. Looking at the more severe outcome of new hospital admissions for Hamiltonians. Keep in mind this is hospital admissions for Hamiltonians, not necessarily the use of our services here in Hamilton. The S2 reopening scenario predicts 73 additional hospital admissions from now, November 15th, to the end of January 2022, compared to the S1 maintained public health measures scenario. Admissions in the S2 scenario will be slightly higher in the older age groups compared to the cases, and primarily be amongst those aged 20 to 59 and 60 to 79. Vaccination of children 5 to 11-year-olds in December will prevent 7 additional hospitalizations right away in January compared with S2. I've not shown it here, but we also anticipate 13 deaths in S2 between now and the end of January 2022, primarily in those 60 years and older. So to sum up, these most recent forecasts for Hamilton indicate that cases, hospitalizations, and deaths continue to be predicted to be lower out to the end of January 2022 than in wave 3 and wave 4, and will likely remain below those levels that we did reach in wave 4. A modest increase in cases, primarily in younger age groups, is expected in November and December due to the increased risk of transmission as Hamiltonians move indoors and reopening continues. Continued use of public health measures with our current vaccination levels can balance the anticipated increase in transmission. In addition, vaccinating children aged 5 to 11 starting in December will have a positive impact and is predicted to prevent 113 cases and 7 hospitalizations by the end of January 2022. With that, I'll turn it back to you, Dr. Richardson.
Thanks very much, Ruth. And so at this point, we're going to go forward with an update around the COVID vaccine. And Melissa Bixa, the manager of the COVID vaccine response, is here to present that part to you. Melissa.
Thanks, Dr. Richardson. So I'm going to start off today by giving a brief snapshot of our overall coverage within our program. As of November 11th, 85.6% of the eligible population had received at least 1 dose, and 82.2% had received 2 doses. The goals of Ontario's last mile strategy is to reach 90% coverage for both first and second doses. Based upon our current coverage rates, to reach those goals, we would need to administer roughly 23,000 more first doses and 41,000 more second doses. This is an improvement from the October Board of Health update, where we needed 29,000 first doses and just over 55,000 second doses. Next slide. This table highlights our program performance metrics and looking at the percentage change in dose coverage week over week. This table highlights that there continues, there continues to be a decline in throughput of both first and second doses administered to Hamilton residents, and recently at a combined of approximately 3,800 doses in the past week. 1 in 10 Hamilton residents are getting vaccinated outside of Hamilton. Next slide. And looking at our COVID-19 vaccine coverage by age, we see that Hamilton residents aged 70 to 84 have reached our current ministry target of 90% first and second dose coverage. Hamiltonians aged 25 to 29 years old continue to have the lowest vaccination rates in our community. Next slide. This table again, this graph again highlights our percentage change in coverage by age. What is encouraging is we continue to see an increase in vaccine uptake across all age groups, especially in those in the younger age groups for second doses. But this is occurring at a slower rate than has occurred in the previous months. Next slide. And moving on and looking at our census tract data, in recognizing gaps in coverage across Hamilton, our census tracts or neighborhoods have been prioritized in the hyperlocal approach, which we have shared in previous Board of Health updates. This map shows first dose coverage, and the map on the left shows the estimated first dose coverage among eligible population and illustrates that many of our low census tract neighborhoods still have lower vaccine coverage. However, the map on the right shows the change in first dose coverage since August and illustrates that these prioritized neighborhoods continue to have some of the greatest change over time. Next slide. This is a similar map except for second dose coverage and highlights the same trend as the first dose coverage, where we see lower coverage in our lower census tract area, however are seeing the highest percentage rate of change in our lower coverage areas. Next slide. I'm going to move on to talk about third doses or booster doses of vaccine. Nearly 11,000 third doses have been administered in Hamilton since August 16th. The largest portion were administered in October and in long-term care homes and retirement homes. However, with a recent expansion of eligibility of third doses, the rate of administration is increasing rapidly so far in November. Slide. As we move forward with the COVID-19 vaccine program, we're in a time where we're experiencing a changing landscape. This slide provides a quick update on where we currently are and where we're anticipated to go over the next few months. At present, our current priority is our last mile strategy as we continue to offer first and second doses to Hamiltonians with the goal of reaching 90% first and second dose coverage. As we've talked about in previous Board of Health, we're specifically focusing on efforts in our lowest uptake census tract areas. And as we've seen earlier on in this presentation, we're making significant gains in these prioritized areas. In addition to our last mile strategy, third dose eligibility has expanded and taking a larger share of our current focus. The majority of individuals following under any of these currently eligible populations will be vaccinated through our usual channels. Doses are available through our newly open public health mass immunization clinics, our targeted mobile pop-up clinics, pharmacies, and both primary cares and participating primary care practices. Specifically, in addition for third doses, there is a healthcare worker-only mass immunization clinics, as well as various occupational health departments administering vaccines to their own staff. Looking ahead for the 5 to 11 vaccine, in the coming weeks, we anticipate the approval of the Pfizer vaccine for the 5 to 11-year-old children by Health Canada. Exactly when the vaccines will become available to 5 to 11-year-olds in Hamilton will depend on the timing of the Health Canada approval and the receipt of the vaccine supply into Hamilton. Many of the channels currently available to eligible populations will be made available to children 5 to 11. In addition, Hamilton Public Health will be offering school-based clinics in our lower uptake census tract areas, and our partners at Hamilton Health Sciences will be operating a clinic for children with needlephobia and/or additional needs. And looking forwards into January 2022 and beyond, we expect further expansions of third dose eligibility. Primary care and pharmacies will most likely be the main channels of vaccine administration for these populations. And depending on the rollout and timelines, needs and demands within the community, mass immunization and targeted mobile clinics may be utilized as well. Next slide. As I briefly just touched on, I wanted to continue to highlight where our operational priorities are and where they and moving forward with the vaccine program. Achieving a high first and second dose coverage remains the focus and main priority of our COVID-19 vaccine program. This applies to all currently eligible populations and will apply once the pediatric 5 to 11 vaccine is approved and in use. On the ground in the clinics, we're ensuring we're adhering to these priorities through prioritized booking. In all Hamilton Public Health-led clinics, individuals looking to book a first or second dose appointment will be prioritized. Currently, anyone wanting a first or second dose can walk in for an appointment, as well as when the pediatric vaccine is approved, approximately 2/3 of available appointments at public health-led clinics will be reserved for first and second doses, and the remaining third will be held for third doses. Next slide. And looking and discussing a little further about third doses, we do want to highlight that 2 doses of vaccine continues to offer robust and persistent protection against severe doses from COVID-19. With the expansion of third doses are not required for mandatory proof of vaccination and are at this time a recommendation. Since our last Board of Health, we have had an updated eligibility for third doses. Currently eligible are individuals moderately to severely immunocompromised, and they can receive a third dose within a 2-month time after their second dose. In addition, we have older adults in congregate settings, community dwelling individuals, adults 70+, healthcare workers, including essential caregivers, Indigenous adults, and individuals who received viral vectors. So that is 2 doses of AstraZeneca or 1 dose of Johnson & Johnson. All of those are at an interval of 168 days since their second dose, which is roughly 6 months. Next slide. There has been a fair amount of change to our channels of vaccine administration since our October update. In an effort to accommodate additional demand for third doses in the forthcoming pediatric 5 to 11 vaccine, mass immunization clinics have been open both for the general public and specific populations. On November 3rd, the first public health operated mass immunization clinic opened at Lime Ridge Mall. And on November 8th, our partners at Hamilton Health Sciences opened a healthcare worker only clinic at their West End clinic to administer third doses for eligible healthcare workers. I also am pleased to announce that there will be a third mass clinic opening this week at the Center on Barton. More public announcements will be held today at the media briefing, but we are tracking to open that clinic on Thursday of this week. Booking into these clinics for first and second doses for the 12 plus population, they can book in via our new Virto scheduling system or via walk-in. And then once the 5 to 11 population, in order to accommodate the anticipated surge of vaccines, it will be through booking through Virto only. And third doses must be booked. Next slide. And finally, I just want to wrap up today's update by giving a brief update on our mobile vaccine program. As per request from the community, our mobile teams have adopted a set schedule of 2 public pop-up clinics per day at either recreation centers or Hamilton Public Library branches. During the week, 1 day clinic and 1 evening clinic are operated, and over the weekends, 2 day clinics are operated. The goal of this set schedule is to provide some consistency regarding mobile clinic locations while still providing citywide access. This slide highlights the schedule for the mobile clinics over the next coming weeks, and our teams have chosen these locations based upon ones that have had historically good uptake and are near priority census tract locations. Once the pediatric 5 to 11 vaccine has been approved, 1 pop-up clinic a day will be held specifically for this population. This is to ensure that we provide ample opportunity to accommodate the anticipated demand while offering access to children and families who may not be able to access mass clinics, pharmacies, or primary care clinics. And finally, as mentioned previously, our mobile teams have also been running on-site clinics for specific populations, and this includes some of our seniors' congregate settings, and this work will continue for eligible third doses in settings that require it moving forward. And that concludes my update today, and I'll hand it back over to Dr. Richardson. Thank you.
Thanks very much, Melissa. So just going to look a little bit more at the current public health services priorities. And essentially, these are 3 things. The COVID response, including both the COVID-19 disease control program that is overseen by Jordan Walker, our senior program manager for all things case management, outbreak control, IPAC, infection prevention and control related to COVID-19, continues to do the work there. And expanding our COVID-19 vaccination program, as you just heard about from Melissa. Just one thing to highlight that we are going to be publishing today, the school-by-school vaccination rates, and those are things that have been seen by our Board of Education partners and the schools in Hamilton. We did match up, as the province allowed us to do, the records from the schools with the records of immunization that we have in our COVAX vaccination system, and created school-by-school vaccination rates for schools with eligible children in them. So, of course, these are for the 12 to 17-year-olds as we go forward. The information is being used to plan our last mile strategy and look at where we can continue to improve our vaccination rates, and is also, of course, being used in the disease response in terms of COVID case and contact management in cases in the schools. So you will see as those results come out, much as Melissa showed you earlier, that our the COVID vaccination rates aren't, of course, a result of any type of school performance or anything like that, but are very much a result of the socioeconomic conditions in the areas that surround the schools. So more details will be coming out on that later on today. The second priority is our deficits of care, as I was identifying earlier, that usually when we look at our programs and services, we base what can be held for a period of time versus needs to be continued based on really an urgent need for those services. And when you're at a point such as we are, where it has now been 2 years that we have been having to hold back on a number of our services, we have not only services that are very important for the public's health that are not underway, but we're increasing deficits in terms of the a number of things that we've been able to do over these last 2 years. So we're looking at examining our programs with that lens in mind. We've been doing this locally. I'm doing this in concert with other health units across the province, and looking at what needs to be addressed first. So we'll continue to come back to you on updates as to where we're moving forward with those things. We're also using a Build Back Better approach when we're reopening any of our programs to apply the lessons that we've learned through COVID-19. Many of those are around the use of virtual services, for example, and how that can be applied as we go forward, and what people's preferences are now that they've had greater experience with virtual learning sessions, those sorts of things. Staff wellness, of course, is our priority, one of our top priorities as well. And so we continue to develop and implement strategies to support and retain public health staff, given the considerable mental health and wellness impacts that have been had because of the length of this response and the deployment, whether it's working in an area that was entirely new to you and had to learn those skills, or whether it's the amount of overtime that people have been doing, as we've noted on several occasions, that's been significant in order to make up for the fact that we have not had as many people as we might need due to urgent circumstances, or just with challenges in recruiting. So a lot of stress as well when we've had several campaigns about the importance of civility and being kind to one another during this time. Our staff on our hotlines in particular, but not only those, also our staff working at case and contact management have experienced a lot of challenges in speaking with some people. And so many different reasons why there is a lot of stress for our staff as they've been going through this deployment. So that is a key priority for us. So that, I'll go back actually just for 1 second and just mention again those FTEs that we talked about earlier, but just there's a little bit more detail I have. So COVID response consumes about 2/3, 63% of our current FTE. 29% are in the vaccine program, 34% in COVID disease control, and then those provincial supports, as I mentioned earlier, that are helping us in case and contact management, and of course our colleagues from the ministry coming and doing our GoVax bus clinics, as well as mobile clinics that they have been doing. We have about 226 FTEs that are continuing on and providing our usual programs and services, and for just over 600 FTE in total, and we would like to ideally have over 700 FTEs in total. So with that, I'll draw it to a close and just take down the slides and answer any questions you may have.
Success. Thank you very much. The prerogative of the chair, if I could speak directly to Stephanie Hughes. Stephanie, if you're still with us, I know I speak on behalf of the entire Board of Health by thanking you for your excellence and your public service to this board and to this city. And I extend my best wishes to you in your continued public service on a national level. They're certainly very, very lucky to have you. So thank you so much.
Thank you kindly, Madam Chair. I greatly appreciate that.
So we have a speakers list, and I'll recognize Councillor Ferguson, please.
Yeah, thank you, Madam Chairman, and Thanks for the update, Elizabeth. It's always very interesting to see you go through this. You know, we seem to be making a lot of progress in the first and second doses. In my experience with people that aren't getting anything, you can't change their mind. And I've tried, and they actually get pretty angry with me when I try to do that. So I let it go. There is a lot of interest, however, in the third dose or the booster shot. And I get the public health updates on a regular basis. It's from you or someone on your staff. And it's very good at setting out where we are. And but as far as the booster shot, it's still not clear in my mind. And if it's not clear in my mind, maybe it's not clear in the public's mind. You have some links, and I went into those links, and it was very good. It tells you when you're eligible. You just put in your personal information, instantly tells you when you can go for your booster shot. But I've looked and looked and looked where I can make a reservation through the reservation system that the city has set up now to make a reservation to get the booster shot. And I can never find the links on your public health updates. And if you Google it, City Hamilton third dose booster shots reservations, nothing comes up. It doesn't give you anything. So for booster shots, once you're eligible, do you just go to a walk-in? Is that what you're asking the public to do? Because you're going to have a big mass of people coming shortly as they get their third shot or get their 6 months up. And so how do you make reservations, or can you not? You just go to a walk-in clinic?
Through you, Madam Chair. So I'll start off and then hand it over to Melissa Bixa. So no, the third doses, as you saw with Melissa's presentation, those are the ones we're particularly asking people to book in as we move through this stage. Our priority continues to be our first and second doses, and as we get into the 5 to 11-year-olds, there'll be more and more that are eligible for those. And so we're absolutely wanting to make sure that there's space and time for people to walk in for those 5 to 11, or sorry, for those 12 plus first and second doses. It's great feedback about the Virdo system and how well it's working and our links are working. I'll just turn it over to Melissa to add anything further.
Thank you, Dr. Richardson. Through you, Madam Chair. Thank you for the feedback, Councillor Ferguson. Yes, the online links to book a vaccine, it should say book a vaccine here, but appreciate the feedback, and we can go back with our comms if it is not clear enough front and center, and what we can do to make that more prevalent. But beside each of the eligibility groups, it should be a blue hyperlink that says to book an appointment here. But we can take that back today and look at it.
Melissa, I did hit that, and it gives you a lot of Q&A, but you can't find where you can book a reservation. And so do I need to go to the Virdo site then? Is that how I make the reservation?
Yeah. So when you, through you, Madam Chair, so when you click the link to book a vaccine, it should take you into that is the Virdo page that will ask you the questions, and you should be able to click through, and either by typing in your address, it'll bring up a map with the locations which is closest, or walk you through to where to book it.
Okay, I think I'm fairly computer literate, but I'm not perfect. I have 3 daughters that always get me out of trouble when I can't figure it out. But it's not simple, and if it would be possible, Melissa, if you could just send to council just the link to reserve, and make sure it takes a spot where we can pick a time. Like the provincial system we had last time was so easy to follow, but this one looked very complicated. And so would it be possible to get the right link that you just got to click on? It takes you right where you make the reservation.
Through you, Madam Chair, yes, we can send an update to Board of Health as well as any additional instructions or how to in case.
That'd be perfect. So when I get questions on it, then I could just forward your link to it directly to them, because once again, I found it too complicated and I couldn't find where you book a reservation. So I look forward to the link coming through to all members of council. Thank you. Thank you, Madam Chair.
Sorry, I was paused. Thank you. Councillor Jackson, please.
Thank you, Board Chair Wilson, and nice commentary from you to epidemiologist Stephanie Hughes and Dr. Richardson, when you made that announcement, you saw my 2 thumbs down. I wish you had talked to me long in advance if there was something we could have done and arranged to keep this wonderful, talented woman here in our corporation. So the nation's gain is our loss. And Stephanie, all kidding aside, congratulations. And I've always enjoyed your reports. Board Chair Wilson, through you to Dr. Richardson. 2 questions, Doctor. I've asked this the last 2 or 3 board meetings and just want to stay on top of things, if not ahead of things. Within your medical community and network, any new wave on the horizon that society has to be concerned about? Or we're looking like collectively someday soon we're crushing this 4th wave, the final wave, once and for all? Through you, Board Chair Wilson, please.
Doctor. Through you, Chair Wilson, crushing the virus, Councillor Jackson. I think what we are doing is learning to live with this virus, and we're not seeing any particular variants on the horizon, nothing like Delta. Dr. Harvey, who does a little analysis with the provincial data for us all over the weekend, each weekend, and sends out, as he says, that Delta continues to reign as queen, although there's a number of subtypes underneath, and so that is good in that we know what we're dealing with right now, and we know just how important vaccination is. It is working against these variants, but it still requires public health measures. As I said, it requires both of those things as we go through. So we are expecting, as you saw with Ruth's presentation, we are expecting a slight increase again in terms of cases, whether we call that a new wave or just sort of trying to begin to understand what it means to live with COVID-19 as we go forward. We do expect that extending vaccines further into the 5 to 11 population will continue to help. But essentially, I think we're going to continue to figure out how to live with COVID-19. It's not a virus that's going away. And of course, we know that global control ultimately is very important as well when it comes to reducing the likelihood of having further variants that may affect us. So we're going to continue to watchfully wait, hope that vaccines get underway across the world in higher numbers, and continue to look at moving forward cautiously, as Ontario has been doing now for many, many months.
Thank you, Doctor. Not the greatest news, if you will, in terms of perfection, but not bleak news either. So thank you for that genuine, sincere response. And Board Chair Wilson, one more question. So Dr. Richardson, you know all the announcements from the province in the last few weeks, generally removing all restrictions, especially indoors, literally reopening the province. Yes, still some masking. Yes, still some safe distancing. Yes, to get 100% of society double dosed. My question to you is, in light of the 22 months where the province has announced things, but sometimes they've announced things and put them as guidelines, and you recall in the early days and months, Dr. Richardson, how it was left to regions and cities how to interpret the guidelines. My general question to you in a very general sense is Hamilton lock, stock with the province in terms of what they've recently announced, capacities, limits removed and all that? Or is there something about Hamilton that we still have a hold it? You can do that, but however, Hamilton's got this special condition or requirement. That's my last question, Board Chair Wilson. Through you, please.
Through you, Councillor Chairman Wilson. That's a very good question, Councillor. And so we here in Hamilton have only a very few things that differ from elsewhere. So we do have the masking bylaw and the physical distancing bylaws in place here in Hamilton, which we would not look to change at this point in time, but we'll continue to review when that might be the case. We don't have any other special letters of instruction that are out other than only the things that you see under the Reopening Ontario Act, although we continue to monitor what the patterns are in terms of disease transmission, outbreaks, where it is that we're seeing challenges, and decide whether or not there is anything more that is needed. So we do, of course, also have the discussions in an ongoing way with the province, and so oftentimes you'll see ending up in the recommendations that come through in the Reopening Ontario Act regulations, or other recommendations from Dr. Moore. You'll see the things that we've been talking about across Ontario and things that we think are very important. And so, whereas we would look at local things based on our local epidemiology, oftentimes those have been, are almost consistently for many months now, those have been integrated into provincial measures. We are pleased with the pause in reopening as the cases went back up on a provincial basis. We were concerned as to where we might be at. And, again, very closely monitoring our local epidemiology, seeing if there's something in particular that's needed here. There are certainly additional measures that are in place in other parts of Ontario based on what they see in those areas. You may know that, for example, Sudbury recently had to step back into a previous stage of the reopening framework because of the disease transmission that was happening there, where their cases had suddenly gone up into the 100 cases per 100,000 population range. And certainly there are other parts of southwestern Ontario that have been looking at similar scenarios and contemplating what might be needed. So it is a possibility going forward as we again try to look at how we learn to live with COVID, and is it more a regional response that is needed versus a provincial response that is needed. So the trade-off between those two in order to have the appropriate number of measures in the appropriate jurisdictions at the right time is what we're all going through and learning about as we go forward.
Appreciate the response, Dr. Richardson. Once again, thanks to your team of Stephanie, Ruth, and Melissa. And once again, epidemiologist Hughes, you will be missed. Thank you, Dr. Richardson. Thank you, Board Chair Wilson.
Thank you, sir. Councillor Clark, please.
Thank you, Chair Wilson. Can I ask Dr. Richardson about the influenza shot? So using me as an example, I just got my third booster because I'm on a drug that minimizes the efficacy or lowers the efficacy of the vaccine. When should I, or when can I, as an example, get the influenza shot? Or should I?
Through you, Madam Chair. So the flu shots are very important as we go forward, and particularly for those that are at higher risk of severe complications related to influenza. So that flu shot can be given at any time in relation to your COVID-19 vaccine. The science has been done. There is no challenge. You don't need to have them so many weeks apart, as was initially thought might be the case, or done essentially out of abundance of precaution as we learn about how they work, but can go forward and have those at any time. They have been rolling out in pharmacies and primary care practices as we go forward. And so booking in to your favorite spot to get that type of vaccine is an important thing to do as soon as possible.
Thank you for that, and that's excellent advice for residents right across the city. For those who are anxious about the COVID-19 vaccine, where would you suggest that they reach out? To the doctor, the pharmacist, to get advice? In my mind, most of us trust our doctors. We've known our doctors for years, so we trust the doctors. So go and talk to the doctor about the influenza. But I'm not sure if they want that mad rush of all those patients coming in asking them just about the vaccine. So where should you, or should they go to get authentic advice on the vaccine?
Through you, Madam Chair. Generally, we do suggest talking to your family physician or to your pharmacist because they know you well. When somebody is looking for advice, they know your medical history often. They may have been providing you with medications and understand what it is that you're taking and how that relates to your medical history. And so we do generally recommend that people go through one of those two channels in terms of looking at the vaccine, looking at what the consequences are, and any concerns that they may have. You can always, of course, call through to our public health hotline as well. That is available. As well, there is a clinic that is looking particularly at COVID-19 vaccine hesitancy that is run as a Canada-wide resource. It is actually operated out of Scarborough. So there is a clinic where they can find information there. And for kids in particular, there is through the Hospitals for Sick Children, there is a clinic that's providing vaccine advice as well. And of course, there's always lots of information on the web. We do really encourage people to make sure they look at trusted sources. And our webpage is both a place where they can find lots of information and a place where they can find links to all of those resources that I just mentioned.
Thank you. Changing channels, Chair Wilson, if I may. The state of emergency for the city of Hamilton, is that still in effect? And if it is, what do we have to achieve in order to step out of that state of emergency? Does that make sense?
Through you, Madam Chair. So the state of emergency still is in effect as we are sitting here today. Certainly that is ultimately an EOC analysis that is done, and I can tell you sitting at the EOC table that that is something that that is on people's minds in terms of how does this fit and where do things go moving forward. I know there is a lot of interest in continuing at this point in time as we are, as I put it, figuring out how to live with COVID and not sure exactly what will come next or what will be needed, and certainly a significant degree of resources continue to be invested above and beyond our usual staff into the response to COVID-19. And so in talking with colleagues across the province, I think all of them are continuing to maintain their states of emergency at this point as well. So it is something that's discussed at EOC, and I can bring back the interest to the group about when it, what might be the framework. But certainly for us overall, when it comes to emergency response, generally we declare emergencies when the resources of the, the responding agency are outstripped. And so that's certainly the case for public health at the moment. And certainly lots of challenges remain, of course, whether we're talking about the long-term care homes, retirement home, or our EMS colleagues, there's certainly lots of challenges that we're all trying to grapple with and respond best with at this point.
So when council declared the citywide state of emergency, that kicked in the Emergency Operations Center. So I think I heard you say that the Emergency Operations Center has their mind to it. They're not necessarily, we're fixed on a specific date, but we, at some point in the future, we have to come out of this. And so they are looking at what thresholds we would need to hit in order to dissolve the EOC and disband the state of emergency?
Through you, Madam Chair, just for the sake of clarity, the EOC can operate without the declaration of a state of emergency. Part of what it does is consider the current situations, the degree of coordination, the degree of resources that are needed, and ultimately decide if it's something that can be done just with a degree of cooperation and coordination across the city, or whether actually a state of emergency is required in order to address the situation. Currently, we're in the full state of emergency, as I said earlier, and EOC, as you correctly interpreted, they are considering the issue and looking at when, and not to say that it's necessarily imminent, but just to continue to monitor and see when it might be appropriate to stop that.
Thank you. And I'm not advocating that we end the state of emergency now or eliminate the EOC now, but I don't believe council set their mind to what the threshold is. Once we hit it, we can get out of the state of emergency. So we need to be thinking about that so that we understand 6 months from now or a year from now, if we hit all these numbers, then we're safe to come out of the state of emergency. So I just wanted to put that on everyone's minds, because it certainly has been on my mind. Thank you very much.
Thank you, Councillor. I don't see any further speakers, so if I could ask Councillor Pearson to accept the chair while I ask Dr. Richardson some questions, please.
Yes.
Thank you very much. To Dr. Richardson, or perhaps to Ms. Mader, I see your name, but it illustrates your presentation that we're seeing, or going to see, or are seeing an increase in case counts due to the gradual reopening and people moving indoors because of the weather. What will this mean for our shelters, as hopefully we will see more people moving into warmer environments? seeking shelter for the winter months. I'm talking about, of course, our unhoused neighbors. How will it impact our capacity strategy? How are we going to respond to that? Please and thank you.
Through you, Madam Chair, perhaps I'll ask Grace if she wants to respond first. Anybody ask Michelle Baird as well if she would like to address that.
Thank you.
Through the chair, good morning. Grace Mader, General Manager, Healthy and Safe Communities. Through the chair to the councillor, we have been working on how we're going to address our winter capacity issues for a number of months now. And at this week's Thursday afternoon at the Emergency and Community Services, we'll be bringing forward our report about our winter plans and about the capacity and how we are going to ensure that we'll do our absolute best to have not only warming centers, but also increased capacity in our shelter system.
Thank you very, excuse me. Thank you very much. I appreciate that. Through Chair Pearson to either Dr. Richardson or to or Director or GM Mader, are we providing the influenza shot as well in our shelter system? Thank you.
Michelle, would you like to speak to that?
Yeah, through you, Madam Chair. At this point in time, certainly the healthcare providers within the shelter system could provide influenza vaccine. Public Health, we don't directly provide vaccines within the shelter system. It's with Shelter Health, and like any other care provider right now, they absolutely could.
Excuse me, thank you. And so just so I understand through the chair, that is for the Shelter Health to determine that?
Through you, Madam Chair, yes. So basically, we don't run influenza clinics directly in all the shelters. We do through our harm reduction clinic, as well as in some of the shelters have drop-in influenza clinics. But if the healthcare providers, if any of the healthcare providers, be it Shelter Health or others, wanted to provide flu vaccine, they are able to do so. So there are opportunities, I would say, I guess, to summarize for you, there's opportunities being made available for people to get flu vaccine in shelters, yeah.
Okay, thank you very much. Through Chair Pearson to Dr. Richardson. Dr. Richardson, just very briefly, I think it was slide 33, you referenced Build Back Better as an approach, and you referenced maybe providing virtual services. I was wondering if you could speak to the extent of how this is going to inform, is it just, not just, but is it public health that we're talking about? Or is it do you think the organization as a whole? I know you can only speak for public health, but if you could unpack that, please, through the chair.
Through you, Madam Chair. Yeah, the phrase has been utilized in a number of different settings in terms of how we're moving forward. So when we're talking about our own programs and services, we are looking at it in terms of what are the lessons, as I said, that we've learned and how can we move forward. I would say the organization as a whole is looking at that as well. And you'll have seen with the Hamilton Reopens pieces that are going on, looking at, you know, what is the culture now? What is the appetite for virtual work versus in-office work? I can't, as you said, I can't speak to the different things that are being contemplated. Grace may be able to, in terms of more so across the corporation. But we're also seeing that when we're looking at, for example, long-term care homes and other parts of the systems. And that's where, you know, the impacts have been significant, and some of those reviews have already been done, like the one that has been done around long-term care homes and what is it that they need to move forward. We're certainly looking at that in different parts of our work. We can't look at everything, of course. The old phrase, can't boil the ocean, comes to mind in terms of this piece and going forward, but certainly looking at where we can learn and do things in a different way. Grace, did you want to add anything from an organizational perspective?
Through the chair, I don't have a lot to add. I think Elizabeth is correct that, you know, particularly we're learning through the shelter system and through even our recreation services as to what that new level is going to look like on a go-forward basis. But I think it is more on a a phased approach on what we're going to learn and how we're going to implement that.
Thank you. Through the chair, I guess I'm just curious because there are Build Back Better is embedded with values and priorities, which necessarily would translate into policy decisions that the council. Oh,
No idea who that was.
Councillor Ferguson. Build Back Better it's implied that it could have some policy discussions because it could mean a change in course, and I would assume that that direction and that consideration would have to be provided by this council. Like, what have we learned? What do we need to do? And that was the essence of my question. If in fact one arm of the organization is giving that consideration, I would assume that the entire organization will have to give that consideration. And I would have assumed that this council, therefore, will have to deliberate on what exactly does that mean? Is it achievable? Is it desirable? And what are the priority and budget implications? So that was the essence of my question to you and through you to Grace. So that's more of a comment. It's not a question. I'm just thinking aloud about the implications of this and you flagging it as an objective. Thank you.
Could I make a response through the chair? I think the councillor is absolutely correct. Those are the things that we will be looking at as we work through our recovery phase as to what implications are long-term and the direction that we need, and we will bring that information back to committee and council for direction.
And if I might add as well through the chair. Yes, absolutely. And I think I think there's various levels of it. And so as we've been doing throughout the response, we've been doing a lot of CQI, for example, whether it's in our continuous quality improvement. There you go again with short forms, right? But continuous quality improvement to look at how we're running our programs and services. What can we do? What can we learn as we go forward? And of course, as an organization, we do that all the time. At the operational level, look at what we can do differently. And then there are the bigger scale pieces in terms of where we can go and what we might do. And so when those look at service level changes or that sort of thing, those are the ones that would come forward where there are policy initiatives, where there are other, higher level changes. Those definitely would be coming through, as Grace said, as part of the recovery elements as we go through the recovery phase.
Thank you very much. Those are my questions. Thank you, Chair Pearson.
And the chair back. Thank you.
So I don't see any further speakers on the list. I'm going to confer with the clerk to see if we have the capacity to receive the presentation.
Through the chair, I do believe that if I think that Councillors Vanderbeek and Marula are present, so we would have quorum to receive the presentation.
If I may ask Councillor Vanderbeek and Councillor Marula. Oh, there I see Councillor Marula. And we need Councillor Vanderbeek. Thank you. May I have a mover and a second to receive the presentation? It is moved by Councillor Ferguson and it is seconded by Councillor Clark.
Vote is and that carries 9-0.
Thank you. We're on to item 10.1, Child and Adolescent Services 2021-2022 budget and base funding increase of 5%. We have Jen Vickers-Manson here to speak to it. Jen, did you wish to give an overview?
Thank you, Madam Chair. What you have before you is a recommendation report for our Child and Adolescent Services 2021-2022 budget. What you can see is included in this year's budget is a 5% base increase from the Ministry of Health, which will lead to a 0.61 FTE increase in clinical services provided through this program. As a reminder, this program does offer counseling, mental health supports to children ages 0 to 18 years of age and their family.
Thank you very much. The speakers list is activated. Are there any questions on the report? Councillor Jackson, is that a question? Thank you.
Didn't get a chance to click my microphone, so thank you, Board Chair Wilson. As always, when I hear about this additional funding, which is great news, Director Vickers Manson, I always ask the same question. A, is it permanent? And if it isn't permanent, will you at the appropriate time advise future councils when the funding may run out so that future councils can deal with the fact if there's budget pressures locally? Through you, Board Chair Wilson, that's my only two questions. Permanent, and if not permanent, will you advise the future council? Thank you.
Thank you.
Thank you for the question. Through you, Madam Chair. Yes, the funding is permanent, Councillor.
That's fantastic news. Nicely done, Jen. Thanks, Board Chair Wilson.
Thank you. Councillor Clark, please.
Thank you, Chair. Specific to our experiences with child and adolescents seeking counseling during COVID-19, have we seen an increase? Has it stayed the same? And do we have the resources to handle the client's requests?
Thank you for the question. Through you, Madam Chair. I think it's probably important for me to set some context relative to pre-COVID. So this system, mental health services, was a system that was stretched not only in our CNAS programming, but across Hamilton and across the province in terms of access to services in a timely way. And of course, there's been a table that's been collaborating for a long time to try to coordinate efforts and services and streamline them so that children and families are able to get services as quickly as possible and triaged accordingly. In addition to that, there has been some funding increases over the last 5 years in specific areas across the province and also in Hamilton. So I'll just give that as a bit of a landscape. And then through COVID, we have all seen through our Board of Health presentations the increase in demand and impact on mental health in our community. And so you will not be surprised to hear that the wait time and demand for services for child and adolescent services has increased during this time. Mm-hmm. And maybe just to give something a little bit concrete. So our walk-in brief services last year at this time we serviced about 290 individuals through that service. And this year today, it's at 578.
So it's more than double just on the walk-ins alone. And can you advise what the wait time was pre-COVID and what the wait time is now that we're in the middle of COVID?
Thanks for the question, and through you, Madam Chair, I can give you our current wait time, and I'll give you kind of a rough estimate in terms of what's happened over the last year. We have a wait list of about 137 individuals right now. Our wait time ranges from 3 weeks to 8 months, and it really is dependent on the type of service that is required. That is about a double in waiting time since this time last year. I will say that we have a service that's offered where everybody comes through the door relatively quickly and is offered a single session. That is designed to allow us to triage care to either brief services or counseling and therapy services, which is a longer treatment service arm, and group services. And so most of the wait times are related to long-term counseling services and group sessions.
And so, to paraphrase Chair Wilson, if a child or family and child find themselves in distress, they can come to the walk-in clinic to get immediate assessment or immediate help, and then it might take longer to get them on the list for the longer-term counseling. Is that what I heard?
Through the chair, that would be correct. And I do just want to advise, Councillor, just to remind the citizens of Hamilton that, of course, there are other services beyond child and adolescent services available in our community, but certainly that is the approach we are taking, as many of our partners in this industry are taking as well.
And you indicated earlier that you went from 290 pre-COVID to over 500. I can't remember the exact number. do we have the appropriate resources to handle that increase in demand?
Jen?
Through the chair to the counselor, we're currently managing that. You can see by our wait list, 137 deep. We are seeing a slower ability to provide service in a timely way in our community, and through Child and Adolescent Services. This 0.61 FTE increase will allow us to address some of that wait time, but it will not allow us to clear it.
And and I don't mean to put you on the spot, Jennifer. You can always get back to us with an information report. Will that FTE that's being provided by the province, if that's not going to clear the wait list, then what would we need to do to clear the wait list?
Jen?
Thanks for the question, and through you, Madam Chair. It's a great question, and I know we're here talking about Child and Adolescent Services, and we have received some base funding, which of course is good news. And there have been some funding increases across our partners who are offering mental health and counseling services in a stepped way. So at different levels of acuity, intended for different to meet different needs. So in order to answer the question for Child and Adolescent Services, it is something for sure that we can bring forward, Councillor Clark, in the future. And we do need to consider it relative to the other funding increases across our community to see what is the best way to move forward.
Chair Wilson, I think it would be very helpful to get that type of information report so that we can understand holistically across the city. Is there an issue with regards to wait lists for adolescents seeking counseling? And I think that's an important number to have so that we can understand what the city can do to help mitigate that. I'm concerned, as we all are, about any child that hurts themselves or hurts others. And if they're needing counseling, we need to understand what that risk is across the city. So, Jennifer, would you need direction? Sorry, Madam Chair. Would Jennifer need direction to come back to us with an information report that indicates what the challenges are citywide, what the agencies are doing, and what the wait list is citywide?
Jennifer, would you prefer that in a formal direction? I certainly would support it, but I'll see what you have to say.
Thanks, Madam Chair. I appreciate the direction of the board.
Okay, so I think we have a motion on the table. Do all members understand the intent of the motion, or would you request Councillor Clark to review it once again? Perhaps Councillor Clark, could you summarize the motion?
Yes, I'm asking that staff be directed to report back to the Board of Health on the challenges with youth and adolescent counseling across the city, and if there is a citywide wait list. We need to understand how many people are getting served, and are people waiting? Like, we have some that could wait up to 8 months on our wait list. I'm curious whether or not that's the same elsewhere. So I'm sorry, Madam Clerk, I'm having some rough time crafting that motion, but that's what I'd like to see.
I think all members of all members of the board understand the intent of the motion. Clerk Kohler, are you okay with the wording as presented to you?
If I can just read what I've written based on what the councillor has said, that staff be directed to provide an information report on the challenges, waiting lists for child and adolescent counseling services.
And it's not across the city, so it's not just specific to the city, it's all agencies and the city.
Okay.
Thank you, Chair Wilson. And I'm trolling for a seconder.
I will certainly second that, Councillor. It's an extremely valuable discussion. After all, our vision is to be the best place city to raise a child.
Okay.
Councillor Marula, do you have a question on the motion, sir?
Just point of clarification, having been an addictions counselor, I know a little bit about the governance model surrounding how the addiction services is basically operated in Ontario. So this is really more of a provincial issue than a municipal issue. But having said that, our addiction assessment services and referral services does fall in within the public health preview, but all of the other agencies have direct linkages to the province, and they're providing that service. So it's a very convoluted process you're asking staff to do, is to go out, search out all of the addiction services, and ask them what their waiting list is. I don't think that, firstly, is fair to staff, and secondly, it would be a waste of time. What we need to do, we need to focus in on what is the public health, Hamilton's public health, the board that we sit on, and the addiction assessment services, because the vast majority of referrals to those agencies are coming from us. We are really the kingpin when it comes to the referral process. So why don't we just ask staff to provide us with an operational review of our own addiction services and what those referrals, the outcome of those referrals are to the other agencies. Voila! So we won't waste staff's time. Appreciate your time, and perhaps we can word the motion accordingly. Thank you.
I'll look to the mover of the motion for a comment.
I have come to rely on Councillor Marula's experience in this matter. I think ultimately we really want to know, are we having an impact? And so I think the rephrasing of the motion would be appropriate. I'm looking to Jennifer or Dr. Richardson. Sorry, Councillor Marula has indicated. Madam Chair, can I hear from Councillor Marula?
Just to help,
Councillor Marula?
If the motion could read accordingly, that staff provide an update on our addiction assessment services and referral services with respect to the outcome basis of that service. So in essence, what we're trying to do is find out how many people are we serving, how many people are actually successfully seeking or obtaining abstinence, and what is the outcome of all the clients that we have served over the years, particularly now after I brought forward the motion declaring opiates an emergency in the city. So I'm glad that we got ahead of that a couple of years ago, but now is the time to really focus in on, is the services actually meeting today's needs, particularly as a result of COVID-19? I hope this helps, and I appreciate your time. Thank you.
May I hear from Dr. Richardson? Sorry, Chair.
No, thank you. I was going to say Dr. Richardson has appeared on the screen, and if I may, I'd like to recognize her, please.
Through you, Madam Chair. Thank you. I just wanted to clarify, we have the two named agencies that are both involved in mental health. And so I believe Councillor Marula's piece is primarily referring to addiction services, which is the ADGS service. Sorry, this is again that issue with us using short forms. Whereas this report is specific to the children's mental health services. So I just ask Jen again what might be the most useful way to frame it. Understanding that the counselors wanting to ask about where essentially are we at in the city around children's mental health, and knowing that there are a number of connections between the agencies, it might be best still to frame it the way that Councillor Marula is saying in terms of what are the outcomes for the referrals from our services. But Jen, just wanted to check in with you.
Thank you, Dr. Richardson. Jen, are you able to?
Yeah, through you, Madam Chair, and thanks, Dr. Richardson, as well as Councillor Marula, for outlining it. It is a bit complex in terms of the number of service providers being funded and the types of services that are offered at different levels to address mental health and well-being in children and youth across our community. So it would be quite a complex undertaking. Appreciate what I think I hear and am understanding is that we're wanting to understand the the size and the scope of issue in the city of Hamilton and the challenges in reaching that issue is what I think I hear us saying. And I certainly know that we participate on a number of tables that can bring forward the size and the scope of the issue in our community. And programmatically, very happy to speak to Child and Adolescent Services where we're at relative to that.
So I'm going to go back to Councillor Clark because he does have the motion on the floor and there's been some suggestions made.
So the motion is worded so far that staff be directed to provide an information report on the challenges waiting list for child and adolescent counseling services within the city's children mental health services. And I think Councillor Marula is speaking more towards the substance abuse side of the equation. Can I hear from Councillor Marula? Because I think we might be able to tweak this and get to both.
Right. My apologies.
Thank you. Councillor Marula?
My apologies, Madam Chair. I used addictions just as an example because of my knowledge surrounding it, but all of the services flow out identically. So in essence, there's always a network and there's always a lead agency, and the city plays that role. Hence, what we need to find out is how many referrals have we received and what was the outcome of those referrals. That captures exactly what Councillor Clark is looking for. So it's primarily an assessment of the entire process, how many people are waiting, how many people are actually getting service, and what is the outcome of that service. Hope that helps.
And so can I, Chair Wilson, I'm sorry, we're doing this on the fly here, but this has been a concern of mine on mental health side for some time, and I know Councillor Marula has worked a lot on this. So it's worded this way, Councillor Marula, that staff be directed to provide an information report on the challenges, waiting lists for child and adolescent counseling services within the city's children mental health services. Would that capture everything?
I believe, Madam Chair, if you incorporate just a network of child services to assess how the network is operating based on an outcome scenario, that's what you're looking for, and I think that's valuable information.
Yeah, if I may, it's Councillor Clark's motion, but you used the word network, sir, and I think Councillor Clark, in my opinion, captures it by just generally referencing, oh, there's a new one up, services. So I trust that is copacetic.
Not necessarily, only because one service, we need a network of services, right? So there's generally a lead agency that provides the assessment and then the referrals. When it comes to whether it be addictions, which is my expertise, but when it comes to other mental health scenarios, there's always a lead agency in town, a champion who's generally referring the most. And I believe City is. That data and the information within, once you dig down into that data, you're going to find the answer that Councillor Clark is looking for. How well are we providing services with respect to mental health as it pertains to children in the city of Hamilton?
I'll recognize Councillor Clark. It is his motion.
Yeah.
So we worded it, Councillor Marula, that staff be directed to provide an information report on the challenges, referrals, and waiting lists for child and adolescent counseling services within the city's network of children's and adolescent mental health services. Would that, okay, perfect. Thank you, Sam. Sincerely, Councillor Marula, thank you.
Thank you. So all members, that is in the chat, the wording of it, I do have just a single question, but it's not really, it's kind of germane to the motion, so I'm going to err on the side of caution. If I could ask Councillor Pearson to take the chair. Thank you so much. To Dr. Richardson, the reason I'm interested in the motion is I know in the population health report that you provide, the last one, 2 questions, really highlighted quite a troublesome statistic, and that is the self-harm among young females, and it just really seemed to appear out of nowhere and was quite sharp. Would that kind of condition be sort of caught in this motion in terms of how the volume of that and how those individuals are being served or not, or on a wait list or not? Through you, Chair.
Through you, Chair. The we would not go back and do sort of an analysis of the statistics that you have seen before in relation to that. Rather, this would be more a description of where the services per se are at in terms of the volume of services that are being sought. So I don't know that you would be able to specifically identify that subset within what Jen is bringing back. But as an overall basis, in terms of the types of referrals that they're handling and the backlogs that are present within the outpatient services, they would be included within those. We wouldn't be looking at any sort of inpatient services.
Okay, thank you, Dr. Richardson. Thank you. Councillor Pearson, thank you for taking the chair.
No problem.
Okay, that was a very good discussion. The motion is on the floor and it is moved by, I'll give over my seconder to Councillor Marula since he was so rich in providing some feedback. So it is moved by Councillor Clark, seconded by Councillor Marula, that staff be directed to provide an information report challenges, referrals, and waiting lists for child and adolescent counseling services within the city's network of children's and adolescent mental health services. The vote is up.
And that vote carries 9-0.
Thank you. We're on to 10.2, which is budget request for Food Advisory Committee 2022, and Kevin McDonald is here to speak to this second discussion item. There are recommendations included in the report. Mr. McDonald, good morning.
Yes, good morning. Thank you this
Pardon the
morning.
interruption.
Oh,
Sorry about that. It's Lorraine Kohler from the Clerks. We need to approve the report.
Oh, I beg your pardon. It is moved by Councillor.
Thank you.
It's moved by Councillor Clark and seconded by Councillor Pearson with respect to 10.1.
Yes,
Correct.
thank you.
Thank you.
My vote
apologies.
is open. No problem. And that vote carries 9-0.
Sorry, Mr. McDonald. You're here on item 10.2.
I am not a problem, Madam Chair. Thank you very much. Kevin McDonald, Director of Healthy Environments Division with Public Health Services. Through yourself, Madam Chair, to members of the Board of Health. The recommendation report before you this morning speaks to the annual budget request from the Food Advisory Committee for the coming 2022 fiscal year. One of the two appendices attached to the report you will see is the City of Hamilton Advisory Committee's budget submission form, which has been completed and submitted by the chair of the advisory committee. I would like to take this opportunity as well to acknowledge Richard McDonald. Richard McDonald, many of you know and will have had the opportunity to interact with Richard over the years. He is our manager of food and water safety. During the past year, Richard stepped up and served as the liaison staff member for this particular committee during a particularly turbulent time. So as part of his business continuity services and overseeing many of the environmental health programs, Richard actually took this on as a new assignment and has been working closely with members of the committee with the culmination of this actual report as well, looking forward to 2022. So Richard's available as well should there be any questions regarding the report.
Thank you, Mr. McDonald. I don't see anyone on the speakers list for questions. So we will now vote on the recommendations. It is moved by Councillor Danko and seconded by Councillor Jackson, please.
Councillor Farr, are you able to vote? Thank you.
Thumbs up. Yep.
And that vote carries 9-0.
Thank you very much again, Mr. McDonald. Any other business to discuss this morning? Seeing none, mover and a seconder to adjourn. Councillor Pearson, Councillor Farr, please.
Counselor Ferguson? There we go. That vote carries 9-0.
Thank you very much. Bye-bye. Thank you, Clerk.
Am I dismissed now, Board Chair?
Yeah.